among the tens of thousands, hundreds of thousands, maybe even millions of people who are wondering about COBRA, perhaps because you've been laid off or perhaps because you anticipate being laid off? Well, here to talk with me about COBRA is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thanks for having me, Bob.
So, Jae, my understanding is that lots of people are searching for information about COBRA these days. Tell us more.
So, Bob, you can understand professionally, I'm a certified financial planner as well as a licensed producer on insurance of all sorts. And my firm, GH2 Benefits, we have a new free tool with an accompanying article just for people who are thinking about COBRA, how much it costs. People see headlines, and we see also another set of headlines which deal with the Affordable Care Act and all of the complications there. So it's really tough for consumers to be able to make heads or tails to try to get the cost down and yet still retain the coverage that may be valuable for their personal situation. What we've done here is we've created an article along with a simple tool, one where somebody can enter certain, information which we do not store, just to be able to get a context of what the price differences are, what they can be. And I'm going to say that we've spoken a lot about other topics, that this specific topic is garnering most of the attention on all of the different links that we have here, both to my name as well as to GH2 Benefits.
Yeah. Now, in the past, when the ACA plans had a advanced premium tax credit, maybe it was a bit of a no-brainer to say, I'll go with a ACA plan, platinum, gold, silver, whatever the case may be. But now, now that the advanced premium tax credit goes away in 2026, people will really need to compare and contrast the differences between either going on COBRA or ACA.
So you've opened, many cans of worms, Bob. So let me try to go in order here. First of all, I wouldn't necessarily call it a no-brainer, right? In other words, there can be, and generally speaking, you hear a horror story about COBRA that you do have to pay 100% of the cost plus a small administration percentage as a fee. That is all true. Nevertheless, there can be nuances, many nuances, where COBRA is actually the place that is most fitting for the newly displaced employee. So I don't want to necessarily say that COBRA is always bad. You can understand that there can be situations where COBRA is in fact the best place for a particular situation. Once you get beyond that, your other points then come into play, certainly, which is that the One Big Beautiful Bill Act will notably hurt the enhanced premium tax credit, advanced premium tax credit. I've written for the Alliance for Lifetime Income for the entire population a research note explaining the interaction of IRMA as well as the Obamacare's APTC, how it works. The issue is that those people pre-retirement, and that extends all the way down to the mid-50s, I would say, just as a number to give you an idea how early it begins, that a married couple who is making, let's just call it $60,000, $70,000 a year, depending on your location, certainly the APTC can be much more expensive going into 2026, in which case now the no-brainer that we had believed becomes far less a no-brainer going into next year. So very, very complicated, just got notably more complicated over the past months.
Yeah. So generally speaking, Jae, premium cost, doctor network, drug formulary, et cetera. I mean, you're still going through the same side-by-side comparisons to see, plus or minus for this plan versus that plan, right?
That is true, except the issue here, Bob, is that what happens if you move from COBRA to a new plan under the Affordable Care Act, you're resetting deductible out-of-pocket maximums, right? Let's just say you have had outpatient surgery in January. Now you go as you reject COBRA and you go to the ACA. The money you've paid for that outpatient surgery doesn't matter now. It gets reset back to zero, meaning that you'd have to satisfy a deductible before you get covered by the new carrier, the new plan under the Affordable Care Act. So what happens is as you get later in the year, it becomes more complicated. Sometimes it's just best to wait until the next calendar year, depending on these types of circumstances. And I've just named one out of hundreds of different examples that I could have possibly.
In some cases, given that there's a limit to the number of months that you can be on COBRA, my understanding, that you may have no choice but for it to end in November and pick up an ACA plan in December and reset the clock.
Yes, that is true. And other possible avenues exist. For example, depending on your health situation, there is limited duration, in other words, known as short-term health insurance, which may be able to be a transition policy that some people may be interested, depending on where you live and the cost, of course, and the coverage for that interim set of months that would take you into 2026. All of that's possible.
Jay, you mentioned that there's a website for people to read the article and use the tool, but you didn't exactly say what it was.
I'm not very good at self-promotion, Bob. It's GH2, the number, benefits.com. And inside one of the menus is going to be COBRA versus ACA decision guide. It's a short article with links to the tool that people can input their individual information. Again, just to get a context, and then people have reached out to us to hear our thoughts from that point.
Yeah. Jay, it's a complicated topic, and I know you mentioned one of my favorite words when we talk about what to do, which is it depends. and there is no silver bullet answer for everyone, right? Every person is a unique fingerprint.
Absolutely. And with many headlines, for example, you may have heard of white collar recession, that the time that people in their 50s up to their 60s are spending looking for new employment is longer than anticipated, meaning that these price differences last longer, meaning that it's very prudent for people to do this so that they can try to, keep the most of what they have for sure.
Yeah. Jay, I'm assuming we didn't miss anything, but if we did, you get the last word.
No, I think that's enough for now, Bob. I don't think we have time for the hundreds of examples. So thank you very much for having me.